Eric Wallis. He's the president of Henry Ford West Bloomfield. Thank you so much for being with us. We know you're always busy over there. How are you this morning?
Doing very well. Thanks for having me on this morning.
So it's been a few weeks since we've talked with you. What's the latest update over at the hospital? Everything getting somewhat back to normal?
Actually, I would say we're establishing what normal is. The good news is that again, we've learned so much in the last 6 months about how the world looks and how do we keep folks safe. We are starting very slowly to see things look more normal. Still taking a lot of precautions here at the hospital. So we're doing, keeping folks socially distant, asking folks to wear masks, screening folks as they come into the building. But from a patient care and a volume of care standpoint, we're actually seeing those things come back to what we would consider to be normal levels. We've actually, even the month here of September will be the first month since March that we've seen the same volume that we saw September of last year. So I would say we're adjusting. We're figuring out how to do this in a COVID kind of world, but things are coming back to normal.
What is the visitation policy right now?
Yeah, absolutely. So last week we actually made a change to our visitation. So we've eliminated the restriction on the hours. So we've gone back to our old visitation, which was you can come any hour of the day or night. So we kind of have open visitation hours. We are still maintaining the restriction on one person per patient. And those folks, when they do come to see us, have to stay mostly within the room of the person that they're visiting. So it's a little more normal, but still trying to limit the number of folks in the building.
So it's good to see that things are starting to edge back to where we used to be. I don't know if we'll ever get back to what our old normal was. Going into flu season, are you concerned that there could be a second surge and even the possibility of people getting the double whammy of getting COVID and the flu at the same time?
Yeah, absolutely. I think that's the number one scenario that all of us in healthcare are very worried about at the moment. We've begun to give people to give flu shots already, and so I would just want to encourage folks to do that as early as possible this year. For the Henry Ford Health System, folks can now go in and talk to their primary care provider, make appointments to come and get flu shots. We do run flu clinic here in the building, but we are asking this year, instead of it just being walk-in, that folks kind of make an appointment to come do that. But yeah, it's again, it's an unknown. There is some thought that says because we are all as a society doing social distancing and wearing masks, we may reduce the amount of flu in the environment this year. But again, there's just so much that's unknown that we don't really want to take that risk. Having a very heavy flu season on top of COVID could be very devastating to our healthcare system.
How is the hospital preparing in the event that we do have a flu season that, despite the measures we're taking for COVID-19, is a little more serious and does mix with COVID-19?
Yeah, I think, again, we put a lot of new plans in place to help us deal with surges. And I think as we've talked in the past, at the height of the COVID response, we were running about, 20% over our capacity with the number of patients here in the building. And so we learned a lot during that time about how will we deal with those kinds of surges. And so we have new plans in place. We have alternate areas within the hospital that we can now set up very quickly to care for patients if we need to. We certainly know now better about how do we stagger or how would we manage more elective or non-time sensitive kind of procedures. And so I think we're in a much better position today to deal with this because we've been through it once. And so I'm not nearly, I wouldn't sit here and say I'm not worried. I'm not as worried as what I was in March and April. At the end of the day, we're still very reliant on folks in our community doing the right things with wearing masks, doing good hand hygiene, doing good social distancing. But I would say, as a community, we're doing pretty well. We today have less than 10 COVID patients in the building, which is, fantastic. We're seeing fewer cases coming to our emergency department. And I think that's a tribute to all of the hard work that not just the health systems in the community have done, but our community itself has done to take this very seriously and try to do the right things. So we're in a much better place today. And again, I think if that kind of surge comes, we'll be much better prepared to manage it.
How has the treatment for COVID changed from the beginning days to now? Because the number of deaths are way down, and that's a good thing. And I would imagine it has to do with how we're now treating it.
Yeah, I think dramatically different is the short answer, because when this first came, we didn't have a treatment for COVID-19. And so in many cases, it was a little bit of trial and error and trying to find things that work for other viruses, things that work for other kinds of systematic responses that COVID kind of mimics. And really over the course of time, what we've seen is that we know that high dose steroids actually make a significant difference in keeping people from progressing to the really aggressive pieces of COVID-19. Certainly, we've seen that remdesivir as a drug treatment makes a big difference for those folks when administered early on. And we're not seeing patients that are rapidly progressing to needing to be on a ventilator, needing to be in the ICU like we were previously. The length of stay of COVID patients, meaning how long are they staying in the hospitals, is dramatically down compared to where we were, in March and April. So the trials that we as a health system have been participating in have taught us a lot. And that's really the reason that those trials are important, is because it gives us a way to try things in a scientific method that allows us to say, yes, this works, and no, this doesn't. Or this has an effect and this doesn't seem to have an effect. And so that's one of the great things about the Henry Ford Health System and our academic bent to how we look at things and the trials that we are participants in. So it really has helped us to evolve that treatment in a way where we are seeing a lot fewer patients progress to those really acute illness phases.
One of the things that we are seeing coming out of this virus, how all the healthcare workers and industry members are working together to try to solve this problem. And obviously, in the beginning, the shortage of PPE was just incredible. And I know Henry Ford just recently released the study about UVC light and how it's effective in killing COVID-19 on the mass. Do you want to explain that to us a little bit more? And could that be used for other equipment as well?
Yeah, so actually, the concept of using UV light was not necessarily a new one to us. I'll give you the example that even today, when we have patient rooms, when someone is discharged from the hospital, if they've had any kind of infectious disease, we actually have a UV robot that goes in as the last phase of cleaning of all of those rooms. And that's something we've been doing for a number of years. What we saw was when we had that shortage of PPE, there were a lot of folks, not only here, but around the country, that were thinking about how could we reutilize PPE that really was in good shape. It wasn't visibly soiled, but certainly needed to be cleaned or sterilized. And so there was some work that was done, and I would say not only here in Southeast Michigan, but partnerships that we had across the country that were looking at how do we use UV light, how do we use actually a couple of other things as well to reprocess those masks and to put them back into use in a very safe fashion. I will say that it was something that we did a little bit of. We didn't do a tremendous amount of it here at Henry Ford West Bloomfield. I feel very fortunate that our health system has an amazing group of supply chain leaders that were sourcing the entire globe to make sure that we had the resources that we needed. And I would still say that the thing that I am most proud of throughout this entire COVID response is that for this hospital, we never once ran out of the equipment that our team members needed.
That's great. Eric Wallis with us on the Oakland County MegaCast. He's the president of Henry Ford West Bloomfield. And in talking about the supply chain, you didn't have as big of an issue as we had throughout the rest of the country. But coming out of this, and if we go into a second surge or there's another pandemic with a different virus, do you think we're going to start seeing a shift in how the PPE is made and bringing some of those manufacturing jobs of that critical supply back here to the United States?
Oh, absolutely. And I think the Henry Ford healthcare system, and along with a few other healthcare systems, have already made investments this year to come together as an organization to actually bring some of that manufacturing back here to Southeast Michigan. We were also very fortunate to have a great partnership with Ford to make sure that, as they were producing some PPE, that we were recipients of that. But I think there's no doubt that one of the key things that we've learned throughout this is that, over the last 10 to 15 years, most organizations have moved toward a just-in-time supply chain, and that doesn't work real well in a pandemic kind of environment. So even today, we now have a warehouse that Ford has allowed us to use or donated to us in Dearborn that has 100 days worth of all of the PPE that our healthcare system would need sitting there in case that this becomes an issue again. And again, our health system is now, partnering and invested in some organizations that are actually committed to manufacturing PPE here in the United States.
So the logistics of trying to balance what may be needed versus what you have on hand, is there a shelf life for some of these items?
Yeah, absolutely. They definitely have a shelf life. And again, having a great supply chain team that is very focused on how do you rotate that stock so that as new things go are purchased and come in, we're taking some of the things that have been there and putting them into use before they reach that kind of expiration date. So we are uber focused on that. That's not really a new thing for us. It's just the volume's a little higher now, and we've got great tracking systems in place and electronic means to make sure that we're not having those supplies go to waste. We and just like every healthcare system have standards to make sure that we're not using expired supplies. So it's something that we're very familiar with.
Eric Wallis joining us. He's the president of Henry Ford West Bloomfield Hospital with us today on the Oakland County Megacast all throughout the local area. Eric, Henry Ford West Bloomfield Hospital in the West Bloomfield community and the surrounding areas is somewhere that people also go a lot for other services beyond medical services in the hospital. It's a place where there's a lot of educational opportunities and recreational opportunities. Are those coming back at any point soon? Is that in discussion? When can people expect some of those programs to be back in your new definition of normal?
Yeah, great question. Some of those programs we've actually restarted. And so today, any of our educational classes that deal with treatment of the patient have been restarted, and we've been very successful in finding ways to, again, space folks out and make sure that we can keep them safe while we're doing them. So today, if you're going to have a joint replacement, we have a joint replacement class that you come to before surgery. If you're going to have bariatric surgery, there's classes that you come to before those. So all of those kind of treatment classes have been restarted. We have decided to hold off at least through the end of the year on things that are a little bit more, I would say, community facing. Many of you know that we have an amazing demonstration kitchen here in the facility. And so a lot of our cooking classes have been we're going to hold off until the end of the year and kind of see where we stand. So it's a little bit of a mix. One thing that we want to do is as we bring those community facing classes back, we're going to do a lot of kind of communication and put out a lot of information about those as they return.
6 months into this now, are you finding people are a little bit reluctant to go to the hospital for some other treatments? Like I know in the beginning, some people were actually dying because they didn't want to go to the hospital. They were so afraid of getting COVID. Still reluctant there, or pretty much everyone's coming as needed?
Yeah, I think we're making some progress there. We're not seeing huge delays or people putting things off quite as much. Like I said, a lot of our numbers are kind of coming back to normal when we look at the number of physician office visits of folks here on the campus. We're within 50 to 100 every day of where we were previously. Our surgical volumes, people coming in for elective procedures this month again is the first month since March that we're seeing the same or more surgeries being done in the hospital than we were this time last year. And so, I think again, as a society, we're all kind of getting used to what the rules are and how do we keep each other safe. And so we are starting to see some of those volumes come back. Certainly for most healthcare facilities, the last few months of the year tend to be our busiest times. And so, we always say 1 month doesn't make a trend, but I'm encouraged by the fact that the month of September, we've seen some of that volume pick back up, and it appears, at least for us, that folks are kind of coming back in and saying, hey, I feel safe to get these things done.
Eric Wallis with us on the Oakland County MegaCast. The hospitals really took a hit to your budget in the beginning of this pandemic. Is it recovering? What's the long-term forecast in that area?
Yeah, no, I think we were very fortunate that we received federal aid from the CARES Act, and I think we have to acknowledge that if that would not have been taken place, we'd have been in a very bad place. But that those funds have at least got us back to a place where we feel comfortable from a net operating margin. The challenge really becomes that even with that funding, we are have significantly less revenue this year than what we had planned. And the disappointing piece of that is that those are the funds that we use to reinvest back into this campus, reinvest back into this community, and so. Some of the plans and some of the things that we were going to be doing may be pushed out a little bit farther or may not happen in this new environment. So we talk a lot about the fact that we don't expect any future help from the federal government, and so certainly part of what we're preparing for is if there is another wave, that we're not going to get additional resources to help us with that. So. We've taken a significant downturn from where we expected to be. At the same time, the CARES Act funding has helped us to not be in quite as dire a situation as what we would be.
Eric Wallis with us on the Oakland County MegaCast. He's the president of Henry Ford West Bloomfield here locally. We pretty much covered just about everything out there, but anything maybe we didn't go over that you want people to know?
Yeah, I think, one of the things that you'd asked about was, some of the volumes and things that are coming back. One of the things I would stress to folks is, we are doing everything we can to keep folks safe. Today, if you come to this hospital and you get admitted, whether through the ED or from your physician's office, we do test every patient that comes into the hospital for COVID, just so that we know what folks' status is. If we have folks that come in for elective surgeries or elective procedures, we do COVID test them 24 to 48 hours prior to their procedure, so that we know that they're safe and our team members are safe. And so, like I said, there are just a lot of precautions in place. I continue to encourage folks that if you have questions, reach out to your primary care doc. But at the end of the day, it's important that folks get the care that they need, not just for big procedural kind of things, but their normal screenings. We're seeing too many folks that have put off some of those screenings, and unfortunately, stories of folks who probably would have been a grade 1 or grade 2 cancer that we're now seeing it as 3 or 4. So because their care was delayed or their screening was delayed. So it's always a good time to get those things done and make sure that you're maintaining your health.
We all need to take care of ourselves during this pandemic and all times. So thank you so much, Eric, for being with us on the Oakland County MegaCast. We appreciate you taking time out of your schedule. Always a good conversation with you.
Absolutely. Thank you so much for having me.